Today's 101.9, it is Greg and Gina.
We're joined by Dr. Ted Bailey. He's the Chief of Infectious Diseases at GBMC. Good morning, Doctor.
Good morning.
So where are we today? Because it's Monday, we're getting a fresh start, and there's a lot of reports about a lot of different things.
I assume we're talking about coronavirus. We've seen a real jump in reported cases here in Maryland between Saturday and Sunday. We're up to approximately 32 at this point. We've been just at a far fewer number. So we're seeing it. We're seeing more testing, which means we're also able to find more cases.
Is it a good idea at this time to reschedule, say, a routine doctor appointment you have? I know you're not, you're supposed to go through your primary care doctor if you're presenting those symptoms of the coronavirus. I know they're discouraging people from just going into the ER without contacting them first. But how about things like, dentist appointments or?
Yeah, that's an excellent question. And the answer is yes. We've seen that social distancing, we're making a big push as a community, as a nation. And one of those is to really discuss with your physician whether or not your particular visit is something that can be pushed back safely. Some can be. Some are so-called routine visits, and those are ones where there's no loss in either pushing it back, or another option that you didn't discuss is doing it remotely, doing it by phone, doing it by Skype, doing it in some sort of telemedicine way.
It's interesting. I never even thought of that.
Yeah, I hadn't thought of that either. I mean, you obviously churches are going into things being online and that sort of thing. You mentioned social distancing. Things like play groups for children, is that something parents should reconsider? I know schools obviously canceled.
Well, again, and this goes back to almost to the way I answered the last question. It's about balancing risk and benefit. And so, there's going to be, for instance, healthcare professionals are going to have to be in the hospital. So there's a question of, what can we do about the children? And we can say that the larger the groupings, the more risk that someone in that group may have coronavirus. That risk may still be low if the amount of coronavirus overall in our community remains low. But we can't say that it's no risk. And so you have to think about smaller groups being preferable to bigger groups. We've seen the CDC recommend, nothing above 50, but that's not some instant cutoff. Below that, there's no risk. It's a continuum of risk down to the smallest groups.
Good point. And we've seen a lot of people buying things up at the store. But what are rather than panic buying, what are some of the most important items you would say that we should all have in our households?
Soap and water or alcohol-based hand rubs. Those are going to be the scarcest, I would say, because they're the most important and because we've recognized that they're the most important. But this is a respiratory virus, but it is also one that can land on surfaces and such that we can pick it up on our hands from objects and then touching our face. So we want to be sure that we're frequently cleaning our hands, and that's going to require alcohol or soap and water. So those would be the fixtures. And then also having environmental, wipes that we can clean down surfaces with. It's effective. And it's necessary.
We're talking to GBMC's Dr. Ted Bailey.
What are some of the classic symptoms of the coronavirus?
Well, I'm going to divide those into two. There's the symptoms that are the most common, but those are also shared with other viruses. So the most common would be fever, a dry cough, achiness, fatigue. Even in some cases, some GI symptoms can be associated with coronavirus. As long as those symptoms are still mild, they're still mild. And most cases of coronavirus remain mild. But the symptom that becomes concerning for this heading in the direction of a severe infection, which a fraction of them do, is the development of shortness of breath, difficulty breathing. That's a symptom that, in which case, you may benefit from coming in and being taken care of in a urgent care hospital setting.
Dr. Ted Bailey from GBMC, thanks very much. How can we get more details if we need them?
Well, I think the most carefully vetted source of details is going to be both the CDC's coronavirus page as well as Maryland Public Health's coronavirus page. Those are carefully vetted. There's a lot of misinformation or just chatter throughout social media. Those would not be good, reliable sources. So I would really tune those out and focus on the sites I just mentioned.